Hello, how you doing, Kanako?
I'm good. Hello.
I'm Dr. Stellmacher. I'm going to be conducting a medical interview to find out about your accident that happened in 2015. So the accident occurred on January 31st, 2015, correct?
Yes.
Do you remember anything about the accident?
No, I don't remember from middle of January to middle of March. So
Okay,
I
so
have no.
your first memory was the middle of March?
Yes, in a
Okay.
hospital on the bed, and I
Okay,
asked
so
my mother that this is my dream, isn't it? And she said no.
okay. So you don't have memory for the time a few weeks before the accident.
Yes, I heard that I went to the birthday party of my friend birthday party, but I don't remember that.
Okay, all right. So you remember, so you don't really remember going back to Japan in the plane
Nothing.
or anything like that. Okay. And then, but you probably have heard where you were. Where did you go when you left the United States?
No.
You
When?
don't remember. Where did you go to when you left the United States? You were in the hospital here, and then you went back to Japan, correct?
Yes. Mm-hmm.
Okay. So do you remember do you know where you went to in Japan when you left the United States?
No.
Okay. So when you remember in March, where
Mhm.
were you in March? What were you doing at that time? Where were you?
I was in hospital in Japan. Then
Okay.
I was on the bed,
Okay.
just
So
lying.
I know that you left the hospital in the United States on a medical transport and you went directly to a hospital in Tokyo. I know that from the medical records.
Hmm.
So I assume that you were still in that hospital
Hmm.
in March when you first remembered things in that same hospital in Tokyo, correct?
Yes,
Okay.
I was in. I heard that I was in Japan. When I back to Japan, I was in a Koseichuo hospital, and I moved to Haseda Rehabilitation Hospital. The, I remember the second hospital in Japan.
Okay. So you were at a rehab hospital when you remember?
Hmm.
Your first memory was a rehabilitation hospital?
Yes.
Okay. All right. And can you tell me what your treatment was like there? What kind of things? What was your day like? What kind of treatments were you getting there?
Yes, treatment is. I remember what I remember is are that the rehabilitation. Then I got three rehabilitations for every day, Monday to Sunday, Saturday, Sunday. Yes, every day.
Okay.
Then the first is like using computer and do the puzzles and quizzes and use the fingers or something I play the piano. And
Okay.
then the speech rehabilitation was like remember that was most tough part for me because I couldn't remember anything at that time. So like to remember the story and words a lot for every day.
So they
And
would read you things. They would read something to you, and they would ask you to try to remember or concentrate and tell them
yes.
things about the story.
Mhm.
Okay. All right.
And the other rehabilitation was like use the physical rehabilitation, like to walk and run. But I couldn't. But use the stairs, like go upstairs and go downstairs, because I
Okay.
couldn't bend my knee. So it was really, I hurt my knees, especially the
Okay.
right knee. Right knee was couldn't bend at all. So it was really hurt.
Did you wear a brace on your knee at that time?
Mm-hmm.
Did
Sorry.
you have something on your knee to keep it from bending, or was it just difficult to bend on its own
Difficult to
because
bend.
it was painful?
Difficult.
Difficult to bend.
Yes. From I remember.
Okay. Were you wearing any casts or splints? Do you know what a splint is?
Right?
A splint?
Sprained?
It's something to hold your muscle or your leg in a certain position. Were you wearing anything on your body, on your arms or your legs at that time?
No, in the rehabilitation hospital. No.
No. And how were you walking at that time? Were you using a crutch or a cane or a walker, or were you in a wheelchair?
At first, I used a chair to move, and gradually I could stand. Then I used a walker and, practice walking.
Okay.
And yes,
All right. And how long were you at the rehab hospital for? Do you remember when you got out? Remember the date approximately?
first memory of the hospital.
No, when did you go home from the rehab hospital?
You mean when I left the hospital?
Yes,
Um,
go home.
May, middle of May.
Okay.
Then I went to the rehabilitation hospital twice a week
Hmm.
till November, end of November
Okay.
of that year.
Okay, so you were doing outpatient, we call that outpatient physical therapy. You went
Yes.
to an office somewhere to do more exercise.
Mm-hmm.
Okay. And so when you left the rehab hospital,
Mm-hmm.
were you using any crutches or a cane or a walker, or were you walking on your own?
No, I could walk at that time, so
Okay.
I so then
Did you have trouble with your balance at that time?
yes. So as I has told you that I couldn't use the stairs. So my house is, how do you say, 1, 2, 3, 3 stairs. My room is the third floor.
Okay.
So, you know, every day when I go to bed or when I woke up, I need to downstairs and upstairs. So it's a bit tough.
So when you went home in May,
Mhm.
in the middle of May, were you
Yes.
able to walk up to your bedroom at that time?
Yes,
Okay,
I could.
okay. All right. And what other things did you need help with when you were at the rehab hospital? In other words, were you able to dress yourself, feed yourself? Did you need help from the staff or anything at that time, other than the walking and the memory?
You mean the middle of the May
From March until May.
after March?
Mhm.
Like when at the first I could go to the restaurant by myself.
Okay, so you needed help with that. How about dressing? Did they have to help you to dress?
Yes, dress. I could wear the tops, but the bottoms are like,
Good, difficult. Yep.
and also the shoes. Yes.
Okay. And was that difficult because of the stiffness in your legs, or was it also because it was hard to remember how to do it? Were you having trouble with memory on how to put? Sometimes after a head injury, people have trouble putting clothes on because you have to remember how to do it. Or was it just physically difficult?
Just because of the physical things.
Okay. What other symptoms did you have at that time when you were at the rehab hospital? Did you have any other symptoms? Was there anything else? Headaches, nausea? Were there any problems with your balance? Um, Other than the memory, were there any other symptoms and the
Mm.
stiffness in your knee? Was there anything else?
The smells.
Okay. So no smell?
Yes, I cannot understand the sense anymore. So
Okay.
I really like the smell of coffee or chocolate or, but now I cannot understand. So it's so sad.
All right, so, and I know that you had some other injuries, like you had a broken bone in your back and a broken bone in your pelvis. Did you have any trouble with that? Did you have any pain there, any problems bending over when you were at the rehab hospital?
Um, the talks. So how do you say? I have the two more on the
Uh-huh.
vocal cord. Then I couldn't speak so normally at that time. Then
You had difficulty speaking?
not so difficult, but my voice was raspy and
Okay, okay, all right. So then you went home in May and you did therapy twice a week at an outpatient therapy. What kind of things did you do there? What kind of therapy? What kind of exercises did they do with you?
it's same as when I was in the hospital. The same things.
So walking stairs.
Yes,
Could you bend your knee at that point? Were you having trouble bending your knee?
I have trouble, so I practice to use the stairs, upstairs and downstairs for every time. And
So mostly stairs and just walking exercises.
yes, and to remember the
And
rehabilitation.
memory. They also worked with you on memory?
Yes, memory.
Okay. All right. Were you on any medications when you left the rehab hospital? Did you have to take medicine every day? What medications were you on?
I took a medicine for throat. I had backflow. How to say? Like sometimes I vomit because of the backflow of the acid on my stomach. So I took
Were
the
you
medicine
taking,
to stop that.
were you taking acid medicine?
Yes.
Okay. Anything else? Any pain medications or medication for muscle spasms or
Medicines. I
you have to take pain medicine for your knee?
No, I didn't use medicine for knee. Just use that practice and rehabilitation.
Okay. All right. And then the spray, and then you had the antacid. Did you use a spray for your throat too, or?
Yes, to nose, to the smell, but it didn't work. And
All right. And okay, so how long were you doing the outpatient rehab? How long were you going to the office to twice a week? You were there, you said you went from mid-May until November,
yes, half a year.
and then you finished no more therapy after that.
Yes, rehabilitation hospital.
Okay. And
Rehabilitation.
did you have to have any other operations on your knee or your
Um,
throat? Did you have any other surgery?
that took the tumor
Hmm.
in my throat, vocal cord. Then there was two. Yes, end of last year, I took a piece to my ankle. I I had a piece on my ankle.
Okay. It was, I didn't understand that word. You had something on your ankle?
Yes, and a piece
Was it a lump?
my bone.
It was a lump on your bone?
Yes, like metal small piece on my
Okay.
ankle.
Okay. And did they have to do surgery on that?
Mhm.
Did you have to have surgery on that?
Yes,
Okay.
I had two
Uh,
pieces on my ankle. How do you
Okay.
say piece?
I think it's like orthopedic hardware, like
Oh, okay. So, okay. They took the metal out?
Remember out?
They had a piece of metal inside your
Yes,
body to hold the bone together, and they
yes,
took the metal out.
yes.
Okay. All right. So, and what, do you remember when that was?
Took the piece at the surgery
Yes. Yes.
end of November
Okay.
last year.
That was, so you're talking about 2015
16,
or 16?
16.
2016?
Yes, 16.
16. Okay.
Yes.
All right. And what was the surgery on your throat, and when was that?
Throat? You mean when?
Yes. When did you have, you said you had surgery on your throat in Japan.
Um, wait. August of 2015.
Okay. So they did one surgery to remove the cyst.
Yes.
Have you had any other, I know all about the operations at the hospital in the United States. Have you had any other operations?
Sorry, I don't remember. In the United States.
All right. No, not in the United States. I meant before the United States, when you were
Before?
younger. Have you
No.
had any operations? No. Okay, and before the accident, did you have any medical problems or were you healthy?
No. I was so healthy.
Okay. Didn't take any medicines every day or anything like that?
No. No.
Okay. And do you smoke cigarettes? Do you smoke? Do you smoke cigarettes?
No.
No?
Never.
Okay. All right. Do you drink alcohol?
Yes, alcohol.
Okay. How often?
How often?
Yes. Yes.
Once a week or so?
Okay. How many drinks?
How many? 2 or 3 glasses?
Okay. And are you single now or
No. Single.
are you single? Meaning,
As
are you married or are you unmarried?
single.
Single. Okay.
Yes.
And what are you doing now? Are you working or going to school?
I'm working.
Okay. What kind of work do you do?
Just office jobs, like do trade bills and calculations or
Okay. And did you work before the accident or were you just a full-time student the whole time?
before, just student. I did a part-time job for once a week or,
Okay. So something similar to what you're doing now.
not the
What
same.
did,
I was working the restaurant as a part-time job when I was student, so
okay. All right. And what were you in school for? What kind of studies?
English literatures.
English literature?
Yes.
Okay. All right. And what year were you in at the time of the accident?
What year?
How far were you in your studies? Were you a freshman, sophomore, junior? What year of college were you in?
Freshman? You mean
You were in your first year.
when? Now? No.
No, before.
Before.
Before the accident, you were at Northern Arizona University as a student, correct?
Yes. When
Okay.
I was, how to say, third year.
You were a third year. Okay.
Yes.
So that's a junior. You were a
Yes.
junior at NAU. You had
Mhm.
one more year to go before the graduation.
I was in Northern Arizona University as exchange student.
But
Then
that was your third year of college.
yes.
Okay. And have you returned to going back to school at all?
In Japan, I
Have you didn't finish and you didn't graduate, you didn't get your degree. Have you gone back to try and work on your education?
sorry. when I was in Northern Ireland University, I was a junior in Japan. Then I back to the university in Japan from September of the 2015. And I started as junior.
Okay. After you returned to Japan, did you go back to school?
Yes.
Okay. So did you graduate? Did you finish your degree?
Yes. Now.
Okay. Okay. When did you finish?
Last September.
September. Okay. So September of 16,
Yes.
you graduated from university in Japan.
Yes.
All right. And how was that in school? Did you still have memory problems? Was it hard to concentrate?
I could concentrate on, but just to remember the classes were a bit tough. So when I was have the examinations, it's a bit tough, but I tried.
So concentration was okay, but you couldn't remember some things. It was
Yes.
hard to, was it hard to make new memories, or was it hard to remember things from the past?
Both.
Was it hard to, both? Okay. And so what about, so we talked about the US before the accident, and actually before I ask you that, I wanted to ask you about your family history. Are your parents healthy? Your
Yes.
mother and your father, do they have any medical problems?
Nothing. They are so healthy.
Okay, all right. So we know about before the accident, your health, right after the accident, you were in the hospital, rehab, you went to the hospital in Japan, the rehab hospital, then you did outpatient rehab. Let's talk about now. How do you feel now? Are you
Now,
having any trouble with your balance, any trouble walking or running or headaches?
almost nothing. I can work and go to the job every day. Then I do things. So what problem I have now is just to smell, or
Okay.
like sometimes I vomit too. Vomit.
You throw up?
Yes, sometimes. So
The food comes back up?
yes.
Okay.
So but yes, that
What about things like math and memory? Doing numbers, calculations, and remembering things. Is that still hard for you like it was when you were studying as a student?
no, I can't remember now. Then
Okay.
I can do the calculation. So
All right, and the stairs are okay now?
yes.
Okay. Do you have any stiffness or pain in the knee or the
No,
ankle? No? Okay. You can bend the knee the same on both
yes, I
sides
can
now?
bend, but still the ankle. Sometimes it not super hurt, but just when I run, I feel so. I don't know how to say it. It's so awkward and not different as before. I got
Okay.
accident.
So the ankle feels different.
Yes.
Um, any trouble with hearing? Did you ever have trouble with hearing
No.
after the accident? No. Okay. And what about like your energy? Did you have trouble with your energy, like feeling tired, going back to the rehab hospital, and then when you went home, did you need more rest than before? Was that hard?
Not so, but it was my first time to go to the hospital every day and get rehabilitations. So it's so bit, I guess, a bit tired for doing that.
Mm-hmm. Okay. Did you have any trouble with depression or feeling sad or down, either before or now?
Just I'm sad. I was so sad.
Before,
Before.
when you were in the hospital? Or is it
Yes.
still like that now?
Not now. Just I was in the hospital.
When you're in the
Why?
hospital? Okay.
Why? I couldn't understand why I'm in the hospital so long, and I could not graduate with my friend. And, I got the accident. So
Right. Did they treat you for depression? Do you know? Were you on medications for it?
meditations?
Were you on medicine for depression when you
No,
were in the hospital? No. Okay. All right.
just I heard that I got the accident in the United States. So I was in Japan. I back to Japan, and I did so many rehabilitations. My mother told me so many times that what happened in the US and why you are in here.
So she had to repeat it over and over again when you were at the hospital because you would forget.
Yes.
Okay. All right. Well, was there anything else that you wanted to tell me about the accident or your recovery? Anything you think would be important for the doctor to know?
No, just now I can work and I can talk like this, and I can spend my life normally. So I'm so glad that I can back like this, normal life.
Huh? All right. I think that's it. I don't think I have any other questions.
Okay, I'm gonna go off the air, okay? Stop broadcasting. Just 1 second.